Hello, my name is Jonathan Strosberg. I'm a medical oncologist at the Moffitt Cancer Center, and it's my pleasure to discuss results of the NETTER-1 trial, the first randomized prospective study of a form of therapy known as peptide receptor radiotherapy in advanced midgut neuroendocrine tumors. So, as a way of background, there are very limited options for patients with progressive neuroendocrine tumors, patients who progress on first-line somatostatin analog therapy. Yet for the past decade and more, thousands of patients have been treated with a form of systemic therapy known as peptide receptor radiotherapy, also known as radiolabeled somatostatin analogues. And what these are basically radiopharmaceuticals that enable targeting of somatostatin receptor expressing tumors. And we know that most well-differentiated neuroendocrine tumors express high levels of somatostatin receptors. The results thus far have come from small phase 2 studies and institutional series and have really been quite compelling, with PFS durations ranging from 1.5 years to nearly 3 years in patients who primarily have progressive tumors at outset. But thus far there has been no prospective randomized study, and the NETTER-1 study was the first study to look at this question of how effective these drugs are in a randomized fashion. So the goal was to enroll patients with progressive neuroendocrine tumors originating in the midgut, the distal small intestine, and proximal colon. The investigational arm was lutetium-177 dotatate. The radioactive isotope is lutetium-177, which is a beta and gamma emitting isotope, which is combined to a somatostatin analog called octreotate. The control arm was high-dose octreotide LAR 60 milligrams every 4 weeks. The primary endpoint was progression-free survival by central radiology review. The central radiologists were blinded to treatment assignment. And secondary endpoints included overall survival, objective response rate, safety, tolerability, and quality of life. The actual treatment, investigational treatment, was administered once every 8 weeks for a total of 4 treatments, followed by standard dose octreotide. So patients had to be adults with well-differentiated midgut neuroendocrine tumors. They had to have proliferative index Ki67 less than 20%. They had to have evidence of progressive disease by RECIST at baseline on standard doses of octreotide LAR. They had to have evidence of somatostatin receptor expression and a reasonable performance status. The primary endpoint was progression-free survival by central review, and you can see on this figure that the improvement was quite substantial. There was a 79% improvement in PFS. The median PFS was 8 months on the control arm. It has not yet been reached with lutetium dotatate. The estimated median PFS is going to likely be in excess of 3 years based on the Kaplan-Meier curves. The statistical significance obviously is extremely high. You can see from this forest plot that patients benefited regardless of baseline prognostic factors, which included somatostatin receptor expression levels, levels of baseline tumor markers, levels of alkaline phosphatase, age, and gender. As far as objective response rates are concerned, it was 18% on the lutetium arm versus only 3% on the high-dose octreotide arm, highly significant. It's important to point out that thus far we have not seen response rates in the double digits with systemic therapies in this disease. So really this is the first time we're seeing evidence of major objective responses with the systemic therapy. Overall survival was an important secondary endpoint. This is an interim look at overall survival at the time of primary analysis, and you can see that there's a clear separation of curves with a hazard ratio of 0.4, a p-value of 0.004. The threshold for statistical significance is actually 0.000085, so a very high threshold for significance on interim analysis. So the best we can say is that there's certainly a strong trend for improvement in overall survival, but that needs to be confirmed on final analysis. So to conclude, this is the first prospective randomized trial of a radiolabeled somatostatin analog, which showed a markedly significant, both clinically and statistically significant improvement in progression-free survival, very significant improvement in response rate, and certainly a very strong trend towards improvement in overall survival that needs to be confirmed on final analysis. So we conclude that for a population of patients that really have very few systemic treatment options, lutetium octreotate represents a major therapeutic advance. Thank you very much.